Hello, everybody. Good morning, good evening, or perhaps good afternoon to each and every one of you who is watching. Thank you for tuning in with us. This is Elder Elite's live session. My name is Bernard. I'm the head of marketing and communications at Elder Elite. And today we have a very special guest who will be with us, and he's beside me, as you can see, with the name of Sukhivinder. Sukhivinder, maybe you can pop on and say hi to everybody.
Hi everyone, greetings to all of you all. This is Sukhivinder here, physiotherapy, and speaking to you from Butwood as well, friend of Elder Elites as well. Yeah, back to you,
Correct.
Bernard.
Thank you very much. Elder Elite is very, very happy to host you in this session. As you can see, or as you can tell, Sukhivinder is a physiotherapist. He's practicing physiotherapy, meaning that he is someone who gives physiotherapy treatment or physiotherapy services to elderly, to each and every one of you who needs the kind of service. Maybe to start off with today's interview session, I was thinking we can start wide. Maybe Sukhivinder, you can tell us a little bit about, the general idea about what physiotherapy is. A lot of people, they heard of it, but they don't know what it actually is. Sukhivinder, over to you.
So in short, physiotherapy, if we redefine physiotherapy, would be physical therapies, right? In other words, physical therapies is a physiotherapist as well. So we are people who work with the physical part of someone. So that means we are talking about the muscles, we are talking about the joints, and muscles will get us to do movements. Joints will help to absorb the force, absorb our weight, and then able to help us to able to perform movements and get us to be as functional as possible. So physiotherapists are people who will work with the muscles, joints, basically nerves, and also they will be looking into the muscles as well as the movements as well, right?
Right.
So
Sounds a lot about mobility, right? I think it has got to do a lot with mobility, helping you to improve structure, your posture, and things like that. But before we get into that detail, I think a lot of people tend to mix up, so to say, physiotherapy and chiropractic, right? I think especially with chiropractic, it has gained a lot of traction lately. I think especially during these COVID days when everyone is just facing the computer, we're just at home. And now we started thinking, I have backache, I have back pain, I have neck pain, I need to see a chiropractor, right? So what is the difference between chiropractic and physiotherapy?
so Bernard, physiotherapists are people who will really work with the strength. Uh, they are people who will be working on the flexibility, on the mobility of the joint, and then they will be also finally working on the balance of someone.
Mm,
So in terms of physiotherapy, we will be actually first and foremost, we will be assessing the quality of the movement in a particular joint, and then we will also be assessing on how strong the muscles are and how well they are being able to execute. And also again we will be able to identify which one is tight, which one is weak, and from there on this will also again directly translate to the balance of a person, right? So this is a job of physiotherapy, and it will take a lot of movements, exercises, manual skills to address a problem. Also physiotherapists will most of the time be working with modalities such as electrical modalities
mm.
or some kind of traction devices to further enhance the effect of a treatment basically. So that is how physiotherapy will be tackling a problem at hand. Now when it comes to chiropractic, we must give credit to chiropractors because these are people who will actually worship the spine. So at any part of your body they will always then relate it to the spine. So these are the spine doctors basically. So these are people who will work with the spine. They are the masters of the nerves. They will know which nerve is impinged and which joint to release basically by using their manipulation techniques to relieve a person. So in terms of the difference between physios will be doing lots of exercises, movements, and strengthening balance and getting back the patient into near optimal or the
Mhm.
best state.
That is
Yeah,
possible.
and but chiropractic, they will be helping us to adjust a particular joint and then basically loosening up and getting the person to be nice and mobile.
Right, right.
Right.
Thank you very much, Suki. I think that is a very spot on, very accurate, and I would say a very thorough answer that actually differentiates, what is a chiropractor, what does a chiropractor do, and what does a physiotherapist do. Now, moving on, since we are, we're talking a lot about the elderlies, right? Elder elite, we are always about the elderlies. So we're thinking, is it common nowadays for elderlies to actually seek for physiotherapy treatment? If yes, is there a reason to it?
So most of the time, Bernard, what we experience with elderly is that these are people who are actually undergoing degeneration. So
Mm,
degeneration can happen on any part of the body. It can happen in the joint. It can happen in the disc, and it can also happen to the nerves. It can also happen to the muscles, right? So if there is degeneration, for an example, if there is degeneration going on in the spinal disc, then we will know that the spinal disc degeneration can cause some kind of compression, disruption, or movement inability in some people with their spine problems. So
mm-hmm,
this is an example of what elderly people are experiencing. And then in terms of muscles degeneration, as we know, the function of the muscle is to be able to perform a certain movement. So in a lot of elderly people that comes to us, we identify that their muscles are degenerated. So the moment they are degenerated, just say in the lower limb, in the hips, or on the knees, that's when they will have difficulty in walking, difficulty in performing simple tasks such as sit to stand, going
mm,
up and coming down the stairs. So these are the problems that they will be experiencing whenever they visit us. And in terms of nerve degeneration, then there will be a lot of complaints of tingling sensation,
mm.
numbness, and an inability to walk long distance, and pains and aches all over the body, which is actually related to the nerves, right? So these are the levels, different levels of degeneration that we see in elderly people. Right.
Right. And I think
Mm.
degeneration generally happens, especially as someone ages. I think it's a very natural
Yes.
phenomenon that would happen. Everybody ages, right? Every one of us would get old one day. And I think
Yeah.
degeneration is something that a lot of us have to pay attention to. And there will be a day which every one of us may come to a stage where we may probably need physiotherapy treatment, right? So now when we talk about, after assessing, right? After assessing the, let's say, motor skills, mobility, the muscles, the balancing of an elderly or perhaps a patient, what you call it as, and then upon treatment, can physiotherapy actually boost the health status or maybe avoid it from deteriorating, or what is it? Can we expect improved health status after physiotherapy treatment?
Mm. This is a good question, Bernard. And
Mm-hmm.
but let me divert to you. In first and foremost, what uh, what will the patient be achieving when they attend a session of physiotherapy is, number one, they will be more conscious of their body. Basically, they will
Right.
be more conscious of their movement. They will be more conscious of their joint. They will be more conscious of how strong are their muscles, or which are the level of movements they can do and they cannot
Mm,
do. So first and foremost, they will gain the consciousness that, hey, okay, this is the state of my body, right? Now the second step is then therefore to improve whichever level they are at. So in terms of strength, physiotherapy can help to boost the muscle power. And in terms of mobility in the spine, in any other joint as well, physiotherapy can help to increase the mobility. We have got certain
mm,
steps that we use, certain devices that we use to improve the mobility in the spine and the other joints as well. And once we achieve good strength, once we achieve good mobility, the next thing that we always want to sharpen will be a balance, the balance in a patient, right? And speaking about balance, speaking about elderly patients and balance, which is balance is actually always closely associated to fall prevention. Physiotherapists, they also do fall prevention rehab, basically, right?
mm.
So these are the things that we can do. So in a nutshell, yes, physiotherapy can improve a patient's status, health status, physical health status anytime, anytime.
Right. And I think it's very important because throughout the answer, what I caught very interesting was this. Physiotherapy is not a one-off thing, right? It's not something that you go today, you do this one time, and then you come off saying that, oh, I'm 10 times better. And I think it's a gradual progress. It takes some time for the patient to, get to a more optimal state or a more optimal physical health state. Right. And I think something that you pointed out that was very important is that through every single session, a patient gets to know more, get more conscious about their own status. And so to say, they will be more aware, can I actually do this? Can I actually do that? So now that popped a question in my mind, which was this. Will there be a possibility that a random young man like myself, or perhaps any random person out there, may actually require a physiotherapy treatment, but because I am not aware, let's say I think my balancing is rather good, okay? I think my balancing is rather well, right? But in actual fact, maybe according after assessments of data and things like that, it may turn out that I actually need it. Is there such a possibility, Sukhivinder?
Yeah, actually, yes, this is a really good question because there are different categories or there are different spectrums basically of strength, I would say, or physical ability. So the elderly who has a lot of degeneration and who has various kind of problems, pains, aches, and all that. So they will be at the lower spectrum, whereby movement will be slightly limited. The things that they will be able to do will be slightly not as optimal as any other person. So this is the one spectrum, the elderly. Now there will be another spectrum whereby a person is active, doesn't have any pain, and he is able to do most of the activities pain free and living happily. But when this patient comes to us, and we will be able to identify which are the hidden muscles, which are the hidden joints that are a little bit tight, and most of the time there will be some areas that the physiotherapist can help to further enhance. Now
Right.
then there will be another spectrum. There will be another spectrum. This is the higher level of spectrum, whereby these are sports people, athletes, and all that. So these are people who are stronger than any other people in the society. So
Mm-hmm.
these people, they would require a total different assessment skill set. So the loading onto the muscles will be different. The joint assessments will be different, and also the requirement to do physiotherapy for these patients will be totally different. So in a nutshell, we are looking at in these three spectrum: the low mobility, the second
Normal
one would
ones.
be normal ones, normal layman, yeah, working layman, and with minor aches and pains. And then the third spectrum would be the ones that are
High
sports
performing.
people and athletes, high performing. Those are the things that we are looking at basically.
Right. And I think
Yeah.
with that, we pretty much covered everybody, right? I think somehow or rather everyone, even like maybe as I am speaking to you, I probably don't know that maybe be this one nerve, this one joint in the back of me that I actually don't know that maybe may not be performing very well that I need to pay attention to. So now, to pull the attention back to our elderlies, right? I think earlier you did some sort to say glance through brought us a very brief through, which is what are the common physiotherapy treatments that are performed on elderlies, right? You mentioned that a lot of them, they suffer from like maybe disc issues or lower limbs and things like that. So what are the common ones that they would usually seek treatment for?
Mm. So Bernard, let us just dive into the spine basically. So
Mm-hmm.
there are various of issues that can happen in the spine. So whenever a patient visits us, then number one is we will be looking into their mobility, and then again we will be looking into their strength, right? And whenever there is this degeneration happening in the spine, then there's another another device that we will usually use to further enhance the joint space basically. So in a nutshell, we will be helping the patient to perform stretching, yeah, manual stretching. We will be helping the patient to do strengthening exercises, and also we have got a special traction device that is used to stretch the lower back and also the neck, which is actually very comfortable to perform.
Right. So it's a it's
This is
a
what we will normally do to the patient.
from what I've picked out from the answers or perhaps from the conversation that we've had ever since the beginning is that physiotherapy is actually a very holistic kind of treatment, right? It involves a lot of major parts of the body, and it's to help the physical well-being, right? The movements to be able to allow someone or to improve somebody's movement to the optimal stage, or perhaps to the very best that the person can, based on their
Yeah,
their very own
on their
physical
ability.
condition, correct. So I think we've pretty much covered a very
Mm.
fair amount of ground today. But before we end today's interview session with you, Sukhvir, do you have any, perhaps so to say, last words or anything that you would like to remind our audiences? Because our audiences who are watching, they may be someone who is young, someone who is like me, they may be, a caregiver of an elderly, they may be a parent, they may be a child. So is there some, a piece of advice, or maybe something that, maybe we should avoid doing that we don't know that is actually hurting us? Sukhvir, what do you think?
Okay, well, I think this advice is actually kind of wide, but generally, this is a simple advice I'd like to give to everyone out there. If you have any kind of pains and aches, uh, you should be able to learn. You should learn how to identify what is the source of the
Mm-hmm.
pains and aches and the discomforts. And I feel that starting from now or today itself, let us all be very conscious of the way we are actually performing movements in our daily lives. And also, I think it would be best if we are able to perform movements and stretches uh, and actually explore the whole body and identify if there's any structures that are tight or not, basically, right? So, yeah,
Right. Thank you very much, Sophia. I
even
think it comes back to a main point you highlighted earlier, which is consciousness, right? As I've always told people, I think knowledge is power. It comes back to the same thing. The more you know of yourself, the more conscious you are with your movements, the more aware you are with how you should perform a certain movement, how should you move, how should you walk, how should you run. I think it would then improve the physical well-being of a person. Because like myself, I do run a lot, but I think I may sometimes be running the wrong way, or maybe running the way that I shouldn't be running, And I think on that note, maybe Sukhvir will give you a shout out. Sukhvir is a practicing physiotherapist who is based in Penang. So maybe you can tell us where your center is, or perhaps anyone who's watching with us, if they're interested to book a session with Sukhvir, what can they do?
so thank you, Bernard, for having us. Thanks, Elder Elite, as well, for organizing this thing. And so we are located in Jalan Hamilton, which is TLC Physiotherapy, and also we do have another sister company, which is Spine, Joint, and Muscles Physiotherapy, which is in Jalan Ongihau, Butterworth.
Right.
So you can find our esteemed physiotherapists over there to assist you. Thank
Right,
you.
thank you very much, Sukhvir. So, Jalan Hamilton is located in the island, and then I think the one in
Island.
Butterworth. So, Penangites are very well covered, regardless of where you are from. You want the mainland, they have one. You want the island, they have one. Thank you very much, Sukhvir, once again for joining us in this session. And I hope each and every one of you who is watching, you have somehow or rather picked up a little bit more about physiotherapy from here and there. Basically, if I were to sum up today's interview in one sentence, it would be that physiotherapy is a holistic kind of treatment that actually would help to improve, using different methods, different ways to help to improve the actions or the mobility of a person to allow someone to move easier, move better, or perhaps to perform in their optimal physical state. Am I right on that, Sylvia?
That's exactly right. Well
Thank you
done.
very much. So one last word from you, and then we can bid goodbye to our audience. Sukya, over to you.
Right. I would like to thank you, Bernard, and also thank Elder Elite for organizing this thing. And I hope that this session will be beneficial to everyone out there. And so get the right therapies and take care of your joints from the early stages. Thank you,
Thank you
Bennett.
very much, Sukhvir. It's been a bliss and it's been an honor to have you with us at this session. And once again, on behalf of LJ Elite, thank you to Sukhvir as well as each and every one of you who's watching. We will see you in the next session. And do drop us a follow, a like, or perhaps follow all of our social media platforms. We will also maybe link Sukhvir's handles up in the caption. So any one of you who is interested, once again, Sukhvir has center in the mainland as well as the island. We will see you soon. Goodbye.
Bye.